Hi, and welcome to the first ever real podcast called Ask John Anything Podcast, or ASAP. We introduced this podcast last time as a way for employees to ask me anything and talk about anything. We've had some success. We've had some things put into the Ask John Anything email. Some of them have been funny. Some of them have been serious. And some of them have been things that, quite honestly, I couldn't answer, but I've tried. So one of the first things that got asked was the really important question from somebody. And the idea behind this is I'm not going to share names unless you say, hey, I don't care if you ask me the name. But they asked me, do I like Chicago deep dish pizza or New York style pizza? And I thought about that for a long time. And I think the answer is depends where I am. And that has a lot to do with the podcast, right? Why we podcast and why don't I just send it out a memo? It's because wherever you are, you got to meet people at. So if I'm in Chicago, it's deep dish for sure. All right. But my sister lived in New York for a long time. And I got to be honest with you, there's nothing like a slice of New York style pizza. Unfortunately, where I live, you can't get either right now, but that's another story. But really the idea behind the podcast is to be able to answer questions, bring information to people, maybe have a little fun, maybe make some souvenirs at some point and giveaways and things like that. But then to also be able to introduce people to other people who are doing great things for our organization. You know, one of the problems with working in an organization this size is that it is really hard to get to everybody. And there are some incredible stories that we're going to want to share over time. Some of the work we're doing, some of the work that people are bringing forward, some of the innovation that the organization is undertaking. You may know I'm also in charge of our digital approach. So what are we doing digitally? And I thought I'd just take a couple minutes to talk about that and to help maybe generate some ideas or some questions as you hear this. When I think about digital health, I think not only about the patient interaction with a physician, for example, and how that's done through video, etc. I think of things that we can do digitally that will help us remove some of the chores we do. You know, there's a saying out there that I'm stealing called, what's a core versus a chore? So the core is what you do, right? It's what we do every day. It's the interaction with patients. It's the, I have to make sure this patient is okay. I write in a prescription. I'm a nurse. I'm doing X for that patient. I'm booking an appointment. I'm doing that. But there's also some chores that get associated with that don't really necessarily add a tremendous amount of value to that visit or that encounter with the patient, but are just necessary evils, right? We all have to do these things. And there's a myriad of them out there. But there's also some technological solutions that we can use to help eliminate those. And what's that really there to do? It's to eliminate the chores so that you can spend more time doing the core of why you're here and what your job is. So we will start to look at technology to try to help eliminate chores and let people concentrate on the core of their job, whatever that may be. So examples, we're looking at some technology right now that may be able to help us do hand washing surveys. Is it a chore to fill out those surveys and to pull people and bring them to places to watch people wash their hands? Absolutely. But is hand hygiene a core of what we do? Absolutely. So we want people to be clean, right? We don't want to spread infection. All the reasons everybody understands. But doing some of that may be a chore. So we're going to try to work through a way to help eliminate those. So those are just some of the things that we're going to talk about over time between Dave Lessard and I on this podcast or vodcast, and I look forward to your input. And until next week, we'll talk to you later.